Welcome to Portal to Health, using the patient portal to support chronic conditions, Microlearning series, brought to you by the California Telehealth Resource Center. This kicks off session 4, Portal Facilitators and Barriers. Before we begin, we want to note that this session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services discussed during this webinar series.
The California Telehealth Resource Center, or CTRC, was established in 2006 to share unbiased, no-cost digital health resources and consultative support services with providers and patients located across all 58 California counties and beyond. As part of the collaboration of 12 regional and 2 national telehealth resource centers, CTRC is committed to implementing digital health programs for rural and underserved communities. CTRC has become part of OCHIN. That happened in 2017, and together they reflect 25 years of practice-based solutions expertise. OCHIN supports safety net health organizations and serves over 6 million patients in 49 states. The OCHIN Health Center Controlled Network, or HCCN, is the largest HCCN in the nation. Health Center Controlled Networks are collaborative groups that provide no-cost, on-demand resources and training to participating health centers to address operational and clinical challenges related to health information technology, very much akin to CTRC and other telehealth resource networks. OCHIN HCCN supports over 100 participating health centers using a variety of electronic health records and serving over 4 million patients, and is funded by HRSA. And we welcome you to check out the OCHIN HCCN webpage linked here to learn more.
And with that, my name is Lulu Gonzalez. I am a learning content designer, and I am joined by my wonderful colleague, Angie Brown, who is also a learning content designer. And before we jump in, here's a list of all of the microlearnings in this series. Each session is designed to deliver quick learnings on a specific focus that can be applied to your patient portal and disease management strategies. These sessions can be viewed in order for a comprehensive overview or as needed for targeted learning. With that, welcome to Microlearning 4, Portal Facilitators and Barriers. In this session, we will cover a few barriers to patient portal adoption, and then we'll briefly showcase the work of a few OCHIN health centers who have developed solutions that help address these barriers.
Okay, so as we head into this session, we want to first look at some common examples of digital health tools that are compatible with the patient portal. These could include text communications such as appointment and health reminders, telehealth visits using phone or video, remote patient monitoring devices such as continuous glucose monitors or BP cuffs, mobile health apps like fitness trackers, diet logs, or mental health supports, and then wearable devices like smartwatches, rings, or biometric monitors. These tools can offer several benefits to patients and care teams alike, and when used in tandem with the portal, they offer integrated solutions. Many of these tools can act as 24-hour connection points to care, allowing for higher degrees of personalization, support chronic care self-management, and can even improve outcomes while lowering the cost of care. But we aren't actually here today to convince you of all the benefits of the portal or other digital health tools. Instead, we want to lean into how to support your patients to adopt these tools when they're the right fit. We say that because these tools may work well for some patients, and others may also struggle to use them or use some or all of them, especially together. So some influential factors can include interests. And that may seem obvious, but having the desire and will to use digital health tools is necessary for success. Also consider patient health literacy and digital literacy levels, which we'll talk more about in a bit. Access to certain essentials such as a smartphone, data plan, and/or reliable internet in the home. Connectivity also depends on where you live. So infrastructure to support cellular and broadband services is not evenly distributed across our country. And then there are linguistic and cultural considerations such as translation and understanding for non-English speaking patients, adaptations for religious or spiritual practices, concerns about privacy, bias, or stigma, and then family decision-making dynamics.
So keeping the portal top of mind, let's first look a little closer at literacy in its many forms. It's important to note that literacy is not an indicator of intelligence. Intelligence is the ability to learn, understand, and apply information, while literacy can be considered the degree of that attainment. Many patients can gain the literacy needed to use digital health tools well. Types of literacy that impact patient use of digital health tools include functional literacy, or the ability to read or write, either in English or in the preferred or native language. Relatedly is numeracy, or the ability to understand numbers, perform simple math, or apply numerical concepts. And then there's health literacy, and this is the ability to seek out, understand, and apply information to manage health. This can impact preventative health, chronic disease management, medication adherence, and other health-related decision making. And in a healthcare context, legal literacy is the basic understanding of concepts that apply to laws and legal documents, such as HIPAA, the Patient Bill of Rights, consent forms, healthcare directives, or forms about financial responsibility. Digital literacy characterizes your patient's familiarity, comfort, and capability with electronic devices, with navigating the internet and performing online tasks such as managing email or filling out an online form. Media literacy is of growing importance and refers to the ability to analyze and act on content from TV, social media, etc., and distinguish misinformation. And finally, civic literacy, which is a level of understanding about our government, rights, and policy which supports civic engagement. And some of these types of literacy directly influence the use of digital health tools, including the portal, while others may sway opinions about the portal and its effectiveness and value. When we explore patient literacy issues, we can identify opportunities for patient success when appropriate supports are made available. The following are a few great examples of OCHA and HCCN participating health clinics that are adapting to literacy levels in their populations. At Nehalem Bay Health Center and Pharmacy in coastal Wheeler, Oregon, bilingual community health workers assist nursing staff to communicate with patients and develop illustrated tools to support diabetes care management. In a health literacy assessment of their patient population performed by OHSU's Richmond Clinic, they found that materials were best written at a fourth or fifth grade level or reading level. They informed a health literacy subcommittee to spearhead targeted efforts. At Bay Area Community Health's Gilroy Clinic in Santa Clara County, California, they treat a large population of migrant farm workers from Mexico. Many have flip phones with limited data plans, which really limits their ability to participate in digital health. As such, many providers use audio visits to align with patient preferences and access. And then, once literacy levels are understood, mindful adaptations and strategies can further support patient use of digital tools.
So, as mentioned earlier, language needs can limit engagement with the patient portal and other digital health tools as well. Language required to access and navigate this technology may be different than the language we use at home. Literacy may not be an issue in the patient's native language, but limited English proficiency may impact the use of the portal, particularly when extra resources beyond translated materials are needed for support. Even if the patient possesses English proficiency and adequate literacy across these domains, access to essential needs such as a smartphone with a data plan, Wi-Fi, and broadband are essential to successful use of the portal. Access can be determined by both individual and community level characteristics. So a patient's socioeconomic status may impact their ability to afford, understand, or feel comfortable with this technology. Some areas have less robust infrastructure to provide broadband or cellular services, and some areas may have none at all. These two things together help create the digital divide, which represents the gap between those who can access technology and connectivity and those who cannot. This can sometimes be considered a super determinant of health. We also want to highlight how attitudes, beliefs, and behaviors that are shaped by our culture influence how we might interact with digital health tools like the portal in deep ways. Some of us may feel like we can't use technology very well. This has an impact on our desire and willingness to use new platforms, even if they can potentially help. And then some of us might feel reluctant about using the portal after having negative healthcare experiences in our past. We may also feel like our health information isn't private or secure, or that we're being monitored more than we'd like to be. Our culture can also determine our preferences. Patients with strong ties to countries outside of the US may prefer messaging platforms like WhatsApp. This can impact whether patients respond to text messages from their clinic and when they're received on the platform that they're not used to using. And then our culture may also determine the language we speak at home and the language in which we prefer to receive healthcare. Often, parts of the portal are not in the same language that we're most comfortable using. So, for example, although large segments of text may be translated into a preferred language, navigation buttons and provider notes may still be in English. For many practices, it can be very difficult to know just how all these factors work together from the patient's perspective.
Yeah, and it's also important to keep in mind that developers generally do not design these tools like the patient portal to be culturally responsive. Instead, the focus of developers is to create tools that securely and accurately support healthcare delivery. Often, it's the human-to-human support that helps patients adopt digital tools across different cultures. For example, we know that digital health interventions that are paired with tech support from community health workers can help patients use those tools more effectively. This is because CHWs can better attend to the cultural and linguistic needs of patients and can help fill in tech and literacy deficits. And in this way, it's important to think of the patient portal and patient portal enrollment as the starting point rather than the end goal to truly facilitate engagement with this digital tool. And with that, we're wrapping up this session, and here are some key takeaways. So, assess patient literacy, language preference, and access to tech to tailor digital health tool and patient portal strategies effectively. Integrate patient portal activation and digital tool use into routine visits and other encounters. And then provide ongoing training for frontline staff to ensure that they can guide patients in using the patient portal. And for that, feel free to visit Microlearning number 3.
Okay, so up next we have Microlearning 5, which are portal adoption strategies. In that, you'll discover approaches to increase staff engagement, campaign tactics, and sustainable digital health practices. So we hope to see you there. And a big thank you to HRSA for supporting this content.
And for ongoing support, make sure to check out our website at caltrc.org, where you can find events, webinars, on-demand resources, and so much more. Or you can reach out to us directly at caltrc@ochin.org. And finally, don't forget to sign up for CTRC's newsletter. Thank you for joining us.
Thank you.